This is it, the unveiling of bioregulation therapy. We're going to get it actually out of the box and we'll be trained on it next week. And what bioregulation therapy does is monitor the body's subtle energies, the communication frequencies in the body, and then feed back what's missing or unbalanced in those back to the body. So it's amazing technology. We use biofeedback for the brain called neurofeedback, and this is for the body. And the docs that I study with have been using this for about a year and testing it out really good and getting amazing responses with it. It fits very well with QNRT and with neurofeedback and with the other tools that we do. So let's open the box and see what we've got here. So we'll get this thing opening up here, and if I can get that on, there we go. So this is it, coming right out of the box. We haven't seen it yet. Okay, so we got some packing stuff, so let's toss that aside. And then we have a bag here. This bag is for the home unit portion of it. We have two things here. One is called the CellCom, and this will be the in-office unit. And it's all in this backpack, so I didn't even know how it was all coming. So let's open up the backpack and take a peek. So I'm going to be kind of careful here. Obviously, it's quite an investment. And this is the main unit. Of course, it'll be hooked up to a computer, and from this will be leads that input from the body. So there will be sensors and monitors that go on, say, the wrist or the forehead if we're working on depression or anxiety, or over the heart, monitoring its frequencies, and then this is the output back to the body. So this is the CellCom unit. And I may not open everything else in here, but we've got, of course, cables and we've got more cables, and then we will have the, this is what attaches to the CellCom, and then at some point in here is going to be the monitoring devices. And what do we have here? This is batteries. And then we have here, so these are the different cables that are not, well, they're going to attach to the cables. These are the monitoring units that will be used over specific areas. So this unit might be used over the wrist, for example, and monitoring the subtle frequencies there. It might be used over the heart. It might be used over the forehead or the occipital area. And so this is what will be monitoring the body's energies, and then the unit hooked back to a computer will be helping the body see what it's doing and what it's missing and what it needs to re-regulate. Now, also in here, of course, we've got information on the, this is the Nesta, and that is the home unit. We've got a bag here. Let's see what we've got here. And so the Nesta is something that a client can rent, or that we can ship to an out-of-state patient that we've seen in the office, for example. And so this would be one of the pads. This could be, out here, but I'll have to see. I don't want to force it out. So this is a pad that would be sitting behind a person, for example, or they would be laying on it, and it would be feeding back the information to the body through PEMF, or pulsed electromagnetic field therapy, low power PEMF. And then this is the Nesta unit that you would wear around. You might actually wear this unit around around your neck and over the body, especially over the heart area. And so this is the Nesta mobile device. So mobile biofeedback for the body using very low frequency PEMF, pulsed electromagnetic field therapy, and other energies. And so that's the main thing here. Let's see what we've got in here. Something from this bag. So this would be the in-office, one of the pads for in-office care, and this again would go behind the patient if they were sitting in a relaxing chair, or it could go on the front of the body or other places to deliver the feedback back to the body. So this is the Cellcom for in-office and the Nesta for at home. And again, we'll be using this. It's been used extensively in the United States by mostly mental health providers that have found a way to do this biofeedback for the body, and they actually get better results with their mental health care. And now it's being used by other providers like ourselves and some of the QNRT docs. And so we'll be using with patients with anxiety, with depression, with PTSD. And this, as I understand, spectrum children, and this, as I understand it, is extremely good for those patients that are very sensitive to everything. Like you can't do much therapy of any kind with them, or it throws them off balance. They're hard to get out. They have all kinds of allergies, sensitivities, difficulties like this. This works extremely well. So we're going to be getting this set up over the next few days. We're going to be doing some initial training next week, and then we'll let our practice members know as soon as we're ready to roll it out with them. And so it's a tool we're very excited about, because I know the developers of QNRT have tested this for a year, and if they say it works, man, I know it works. So so we're looking forward to bringing it into our office, and we'll keep you updated.